what we found out about the vaccine here at Judicial Watch and the lies they told us about the vaccine is shocking. So we've been getting some transparency. The good news is out of the Trump administration about this corruption issue of Rachel Levine, the transgender extremist who was a senior official in HHS. And while there, she was promoting transgender extremist treatments of children and basically trying to rig the science, right? Which is, according to the left, an original sin for anyone. And so we have a lawsuit pending on that issue. But in response to the lawsuit, we got related documents that show that really what I call the malicious effort by the Biden gang to force vaccination on healthcare workers and other American citizens. And the documents, as the press release reads, detail the mandate of the vaccination, the COVID vaccinations for 17 million healthcare workers. And the document was drafted in a way that was written beforehand as close hold. So they didn't want everyone to know about their plans to essentially force an irreversible medical treatment on healthcare workers because of their alleged powers. And I was never convinced they had these authorities, even under the law, related to Medicare and Medicaid. On November 4th, this is what the document reads. CMS will release an emergency regulation requiring staff vaccinations for 15 specific healthcare provider and supplier types participating in Medicare and Medicaid programs to address the urgent need to protect patients against COVID-19. So this was in 2021. These requirements will apply to approximately 50,000 providers and cover more than 17 million healthcare workers. And of course, they mandated the COVID vaccine for all its facilities following this internal analysis that they admitted would cover 17 million workers. But what's outrageous, in the same document, the HHS officials acknowledge a series of or significant numbers of adverse events, injuries related to vaccines. As of November 1st, claims alleging injuries, deaths from COVID-19 countermeasures, they call it, have been filed with the Countermeasures Injury Compensation Program, including 2,229 claims alleging injuries from COVID-19 vaccines, an increase of 133 in total claims over the prior week. About 90% of the claims are awaiting medical records for review. To date, 91 claims are in medical review. 3 claims have been denied compensation. 1 claim has been determined medically eligible for compensation. However, the program is still working with the claimant to obtain the necessary information to determine the compensation amount. So, on the one hand, they're happily announcing and planning secretly to force 17 million Americans or workers in the healthcare industry to vaccinate in order to be able to work and feed their children and families, while acknowledging there were thousands of injuries related to the vaccines they were forcing American citizens to give up their bodily autonomy, their liberty, their freedom in order to comply with the mandate. There's got to be accountability for that, in my view. There's got to be accountability. And of course, we're exposing this in a significant way thanks to this little old Judicial Watch FOIA lawsuit. And there's other material in the memo showing, as it relates to COVID, they spent $35 million on family planning. What does that have to do with COVID? Yes, I'm sure the healthcare experts will lecture us ad nauseum on how it's related, but no normal taxpayer thinks that we should be spending $35 million on one area of healthcare to pretend to address COVID. The left used COVID as a vehicle, a portal to spend money and expand healthcare government-controlled healthcare, increase expenses to you, the taxpayer, essentially cement and expand socialized medicine. That's pretty clear. And there's another, and this is another part of the memo that gets me mad. Vaccines and testing in Indian country. Indian Health Service tribal and urban Indian program sites receiving the vaccine through IHS have reported administering 1.7 million doses of the COVID-19 vaccine as of October 31st. So, frankly, if I were an Indian rights activist, I would be angry at numbers like that. But, I guess to the degree we're allowed to ask questions about COVID now under Trump and Elon Musk's Twitter, and the fact that the other social media has stopped or mitigate or at least seemingly stopped in some ways censoring questions about it, it is frustrating that we had this vaccine that was so controversial and so experimental and so revolutionary, by their own admission, forced on people and promoted by the government with, in my view, insufficient concern about the risks versus the benefits. And that's the nicest way of putting it. And I know people feel strongly about it, but what we found out about the vaccine here at Judicial Watch and the lies they told us about the vaccine is shocking. And it makes me think, what else have they been lying about vaccines generally? I mean, that's the conclusion I have, given the corruption around the rollout and the suppression of dissent over the COVID vaccine. And you can read a lot of, and I encourage you to go to my new book, Rights and Freedoms in Peril, where we describe so much of what we uncovered about COVID-19, the Fauci gang, and the vaccines. It's a great way for you to get yourself up to date, not only in that important scandal, but other scandals that have imperiled, and in my view, continue to imperil our freedom. And of course, much of this material is also available on our website at judicialwatch.org. These new documents are an astonishing example of Biden regime maliciousness on COVID vaccine mandates. The same close hold plan to mandate COVID vaccines also details thousands of vaccine injury claims. So that's the big takeaway here. And I encourage you to review this document and ask and demand. And I think HHS Secretary Kennedy, despite the media smears on him, is going to be insistent that this never happens again. And we should be insistent that he is insistent that something like this never happens again in terms of mandates, etc.
Thanks for watching. Don't forget to hit that subscribe button and like our video down below.